All right, looks like we're recording. Well, thank you guys very much for having me. I met Julie recently at a Silicon Valley Senior Roundtable, and we were just talking, and she said, "Well, you should come talk with this group here." And so I appreciate you guys having me and extending some time. I'm going to tell you a little bit about WelbeHealth and really more generally what PACE is, this program of all-inclusive care for the elderly. WelbeHealth's not the only company that's doing it. It's actually a federal program that has been around actually for a little over 50 years, but it's really kind of gained steam within the last, I would say, 8 years or so. And so that's when WelbeHealth started, was in 2016. And so I'm going to tell you a little bit about the program. At any point, if you guys have questions, this is informal, so feel free to let me know. I'm happy to answer any questions you guys have. So again, WelbeHealth's program of all-inclusive care for the elderly.
All right,
I'll go ahead and jump in here.
937 Via Casitas, Green Bay, 94904.
Margaret, you need to mute.
So we're going to see sometimes this video plays with sound, sometimes it doesn't play with sound. So you guys give me a thumbs up if you can hear sound once it starts playing. If it doesn't, we'll just go ahead and skip on past
Okay,
it.
I'm actually on a Zoom call, but I'll try to do both.
Thumbs up.
Margaret, you need to mute.
I got her. I got her.
Can you guys hear sound right now
Yeah.
Yep. No.
Okay. for the video?
Yeah.
Great.
I'm not hearing the sound.
Yeah, I don't hear it either.
You don't hear it either? Okay, let's see here.
I think there's a share sound like when you're before, like get out of the screen, and then once you click on the clip of what to share, before you share screen, there's a place to share sound, if that makes sense.
I'm just gonna skip it. I'd say about half the time it does that. So it's just a little infographic that talks about it, but I have slides that can do the same thing. So
Okay.
we'll skip on. Thank you for letting me know that you guys couldn't hear the sound though. That's like I said, I'm better at it through Teams than I am through Zoom. So so the purpose of WelbeHealth, the mission for the company when it got started was to kind of choose one part with healthcare, and specifically with senior healthcare, where they could really make a difference. And so what this is for kind of high need, both from a medical perspective, but also from a financial perspective. And what it does is it gives them a whole list of medical benefits. It's funded through either Medi-Cal or a combination of Medi-Cal and Medicare. And really the purpose is to unlock the full potential of the most valuable seniors, help them to remain independent for as long as possible. And I'll talk about how it does that. And before I jump in, WelbeHealth is kind of founded by 3 physicians, and those physicians really, the interesting thing about it is that they don't just put growth of the company first. They're kind of the first primary goal for us is clinical excellence and doing a great job and leading with compassion. And so they really, everything we do is centered around these 3 things. So courage to love, prioritizing human connection with every life that we touch, pioneering spirit, relentlessly pursuing resourceful solutions to support participant health and independence, and shared intention, working as a team with a common purpose. So, again, with PACE, what it is you're the insurance company, you're the care site, and you're the provider. And so you're able to do a lot of things that sometimes are creative solutions compared to the health insurance landscape. And so I'll talk a little bit more about that as we go. We mentioned where our locations are. So San Jose opened in January of 2024. Right now, this lists 8 centers. There's actually up to 11 centers now. We opened up another one in Riverside in Southern California, Coachella Valley in Southern California, and Carson in Southern California. Our next one is in Elk Grove. And so really they go county to county as they're doing these, and that's where we get the approval to open it, is at the county level. So I mentioned that if somebody has Medi-Cal or Medi-Cal and Medicare, then all of these insurance services are covered at no cost. And so we'll go into depth what that is, but the quick version is it's your doctor, it's your OT and PT, it's a social worker, a dietitian, and there's a day center and a cafeteria. Dental, vision, and hearing is covered. and then transportation to and from the center and to and from all of your secondary appointments, including things like dialysis. So all of those things are covered 100%. So this is an all-inclusive program. There is not a cost for it if you have Medi-Cal or Medi-Cal and Medicare. If you just have Medicare, you can pay for the program, but I would say 99.5% of people that are involved in the WelbeHealth program have Medi-Cal or Medi-Cal and Medicare.
I was under the impression that you had to be both Medi-Cal and Medicare approved. Is that not the case?
Yeah, that's not the case. So I would say our typical range is about 50 to 70% on a month-to-month basis are dual eligible. But there's definitely a lot of folks that are Medi-Cal only. And in fact, we have somebody on our team, which I'll talk about later, that is a Medi-Cal specialist. So on our outreach team, we run into a lot of that out and about where somebody's interested in the program, but they don't have Medi-Cal. And maybe, you know, they even looked at a year or two ago and didn't qualify. And with the new changes to Medi-Cal, a lot of people are eligible. Let's say you're somebody that owns your home, but you don't have a lot of income. You know, that's somebody that wasn't eligible 2 years ago because of that home ownership 2024. Now you actually can qualify for it. So we have a Medi-Cal specialist, and you can definitely do it with just Medi-Cal for zero cost, all inclusive. Yep. So that's on the insurance side. So we're the insurance company. We're also the provider, and we're also the care site, right? So this isn't something where when our doctor recommends something or a physical therapist recommends something, this doesn't have to go to an approval and come back down. We're the approver. We're the person recommending it. We're approving it. And so when we do see somebody that's in need, it's able to move pretty quickly. And the care plan that we create is really detailed. And I'll talk about that again a little bit later. But when somebody starts with the program, they actually meet with all of their specialists and they make a care plan that's reviewed every 6 months. And that's something we have to turn into the state as well. So on the state end, they regulate those care plans and make sure we're doing what we're say we're doing. And it's really a great program. This is a slide here that I will probably spend my most time on here, but this talks about all of the benefits that you get with a PACE program. So I'm going to start with medical care. So the doctor includes, you know, the program includes your doctor, your primary care physician, which is in the center here. Now, one thing that's interesting with PACE is that they limit the caseload for all of these specialists here. So they break it into they call it a pod of about 100 to 120 people. And so that group of 120 has the doctor and then everything else that's listed on this page here. Once it gets to 120, then the next pod opens. And so each primary care physician that is in the PACE program has a maximum caseload of 120 people, which is pretty remarkable these days. You know, a lot of physicians, you know, if you talk to them, it can be 1,000 or 1,500 as their caseload. And so the amount of time that they're able to give to the participants is really high, and the amount that they get to know and really they're able to recommend tailored solutions for people is high because of that caseload size. So that's the medical care. Care coordination. So this is team support from doctors, nurses, nutritionists, and other healthcare professionals. So every person that's on this team, doctor, OT/PT, nutritionist, social worker, day center, and home care, they actually get together and they make this care plan for the participant. So whenever, let's say, the physical therapy changes what the needs are for something, that's actually reported back to the whole IDT team. That includes when you go to a secondary doctor. So not only do we organize the appointment, let's say you're seeing a heart specialist, not only do we schedule that appointment with the cardiologist, drive you to and from the appointment, but within 24 to 48 hours, the notes from that appointment come back to the IDT team and they're reviewed. And so that coordination of care, the way that they're able to take that, you might see a heart doctor and your nutritionist may do something to adjust your diet in that following week without you having to do any of that care coordinating, or your loved one or whoever's helping you manage that care. So care coordination, I would almost rank as the #1 part of a PACE program where it shines compared to other healthcare options. Another area is that it includes dental, vision, and hearing. So when somebody has Medi-Cal benefits or Medicare benefits, sometimes there are some benefits that include dental, vision, and hearing, but there are limitations, and you have to really look at which plan you have and choose those details. And so with this plan, dental, vision, and hearing are included just like everything else with zero cost. That includes if you do need something like oral surgery, or you need a root canal or a crown, where dental insurance through Medi-Cal, depending on what you have, you may end up with a cost, maybe $1,000 or $1,500 for something like a crown or a root canal, versus this, everything that we do has zero cost. Physical therapy and occupational therapy is the next one. So this is another place where I think we look at it a little bit differently. And so I think with a lot of health insurance, physical therapy is something that happens after an event. We've injured our leg, we've injured our back. We're seeing the physical therapist, and they're going to give you a recommendation to go visit somebody, and you may get 3 visits or 5 visits, or maybe even 10 visits. It's usually in response to something that happened. It usually ends at a certain point. And so with our healthcare plans, a lot of times because we're trying to keep people independent for as long as possible. Physical therapy is something that doesn't just come after an injury. So you may just see physical therapy to strengthen your legs, or occupational therapy to work through strengthening your arms. And so whether it's following an event that happened, or whether it's just trying to, again, prolong the independence that you have in the community, exercise, physical therapy, occupational therapy are included through the program. I mentioned transportation earlier, but transportation to and from the center, we have our WelbeHealth vans that you'll see all around the community, and they're nice. We can equip wheelchairs, motorized wheelchairs. They're very safe and compliant. Nice brand new vans that just were purchased in 2024, so they are all around, and that includes secondary appointments. So you're going to see the cardiologist, you're going to the dialysis center, our transportation is going to be bringing you to and from. The other nice thing with transportation that I'll mention is that, especially if it's a family that's caring for a loved one, for a long time they've been doing a lot of this care coordination. They've been scheduling the appointment. They've been, taking mom or dad to the appointment, or whoever it is, right? With this, as soon as that person gets to your house from transportation, they have eyes on all the way from the van to the center, into check-in, and then whatever it is that they're doing, whether it's the day center or seeing the doctor or OT PT, or they're meeting with the nutritionist, back to the van and home, there's eyes on for that entire time period. So transportation is not just the convenience, which is, I think, a huge feature. It's also that peace of mind that from beginning to end, you have that eyes on for the person that's participating. In the center here, we have social engagement. So there is a day center. Some people will attend it a day a week. Some people attend it more or less, depending on what their needs and what their preferences are. But we're going to have typical things like some light exercise, or some bingo or crafts and things like that. But yeah, just social engagement goes on in our day center. We also have a tablet that everybody has that comes home with you, which is called a GrandPad. And that's going to come back. It gives you things like appointment reminders. You can video chat with the advice nurse. You can play games and FaceTime with friends and family and things like that. But that comes with the program as well.
So you're supplying them.
We're supplying the GrandPad. Yeah. And so when they started doing that is, so WelbeHealth started in 2016, but we actually had 2 centers that opened in 2019, right? 2020 presented its own sets of challenges. And I think the GrandPad was something that they deployed during that time that was really, really helpful. One, to connect people, one, to be able to interact, and again, just to have that connection on top of all of the appointment reminders and things like that, medical records. So
And does that also include support service that comes with it? You teach
yeah.
people how to use them?
Oh, absolutely. Yeah. So when you receive it, definitely they walk you through it. And basically what it is, for anybody that hasn't seen the GrandPad, it's about the size of an iPad mini, and it has icons that are about, they're probably about this big around, and it is really user friendly to use. There's about 8 icons or 10 icons. And so the setup is done for you if you want to, let's say, because for the GrandPads, incoming calls can only come from numbers that you've programmed in. And so a lot of times they'll sit down with you, they'll help you program in family members that you want to be able to call you. You can call out to anybody that you want, but they limit the incoming calls just so you're not being bothered with that kind of thing. But yeah, it comes with somebody in the group that helps you set that up. And yeah, that's definitely a part of it. Moving on to the final one, which is prescriptions. So prescriptions are included 100% as part of the program. We use prescription delivery, works out really well.
Wait,
In fact,
excuse me. Did you
yeah.
talk about the home care?
Oh, did I skip right over home care? I did, didn't I, Julie? Thanks for keeping me honest there. So, and that is a great feature as well. So we do have home care and home health as a part of this. And so, with home care, one of those first aid assessments is somebody's going to come out to your house, and they're gonna go through a worksheet with you of things that you need help with. That typically it's activities of daily living and related. To that kind of thing, but they're going to be delivering you hours for home care. And so one of the assessments is home care need. And then when you do have something that requires home health, we have home health as well. And whether that's, changing wounds and dressings, or there's other needs that come about with that. But yeah, home care, home health are both included. Same thing, no cost with those programs. Um, on to prescriptions. Prescriptions do deliver out once per month, and they're really nice. They're sorted by the day and by the time of day, which is nice for two reasons. One is there's no more, getting all of your pills and then sorting them into boxes. They're sorted for you. The other place that's nice is that it's a visual indicator whether you've taken it or not, right? If there's somebody that tends to be forgetful if they've had the pill or they haven't had the pill, then that is sorted out. And so again, what this is meant to be is kind of all of the services that somebody might need, all consolidated into one place, all care coordinated by one team to really deliver an excellent healthcare experience. And so, what I'll talk about next, and in fact, before I do that, you guys have any questions on this? I know there's a lot of info on this slide, so if you have questions, please feel free to let me know.
Yeah,
So
I'm
on the home
assuming,
care, can you go over the ADLs that you can get assistance with, and then how many times a week, or is it per case or what?
Yeah, yeah, and well, so it's all. I mean, so I would say all six ADLs. So it's anything you need assistance with, and they just tend to start with the ADLs, right? So ambulating, grooming, toileting, dressing, eating, bathing, they're going to start there. And what they're going to do is they're going to go through a worksheet, which is actually a weekly worksheet. And they're going to determine, okay, if you need help with this, here's how many hours that corresponds to. And at the end of it, they may assign, okay, you're assigned 14 hours per week for your home care needs. And then you would look at that and they'd say, okay, that's 56 hours per month. And that's how they would determine it. But it's all needs based. It's a home care coordinator schedules that. So, you know, somebody that's a specialist in home care is coming out and doing that assessment for you. And so a lot of times we do get the question. In fact, I'll answer it in case any of you guys have it in the back of your minds. Is how is this similar to something like IHSS, which is in-home support services? So in-home support services does determine hours in a similar way, but they're including it in their bucket is a little bit different than our bucket. So our bucket specifically home care, right? We're not including transportation in that. We're not including day center, physical therapy, occupational therapy. Those things aren't included. We're just talking about the hours of home care. With IHSS, they're going to look at those same activities. They're going to look at companionship. They're going to look at transportation. They're going to look at kind of a list of things like that. And so as we look at it, what we're always trying to do, because the numbers do work a little bit differently. So let's say IHSS has 80 hours and our home care hours are 60 hours. Then we may look, okay, well, you're in the day center for a day, and there's your 5 hours, which is 20 hours there. There's the transportation to and from the center. We're going to do the prescriptions, so you're not having to pick that up. And so we will work through that equation to kind of show. A lot of times it's a lot higher on the PACE side, even though the number that you get for the home care looks lower than IHSS. So that's kind of a long answer to a short question there. You had a second part of it, Julie. What was the second part of
Then
your
how
question?
about nutrition? So who monitors that? Do you?
Yeah. So there's a registered dietitian, and so in the day center, so the nutritionist, there's one nutritionist for every 2 pods, and so they're going to do two things. One is they're going to curate the meals that are going to be there on your days, right? So there's some people with special needs for dietary reasons. There's some people who can eat this and not that. There's some people that can't eat a hard food at all. It has to be pureed or it has to be soft. And so she's going to work to make sure on the days that you're visiting the center that food is here and prepared for you while you're here, whether you're here for breakfast or here for lunch. She'll also work through that dietary plan for when you're at home too. If you have certain conditions, giving recommendations for diet. And so yeah, that registered dietitian is a part of the IDT team. And one of those first 8 meetings that you have is with our registered dietitian here.
I've got a bunch of finance questions. Are you gonna cover that later?
Yeah, yeah, we'll cover that
All right, I'll
later.
wait.
Yeah.
I'll
Okay.
wait.
All right,
Thank
sounds
you.
good, Skip. All right, so we'll pop to the next one then. This is just some pictures of the San Jose Center. On the upper left is the day center area. On the upper right is the clinic. On the lower right is our physical therapy suite, which actually has some more equipment in there since this picture was taken, but it's really nice. It has a beautiful big window on the side, and so as you're doing your physical therapy, there's a lot of natural light that comes in, a lot of green trees in the area. And then on the lower right, there's one of the 4 suites, which is our dental suite. So you can see the dental suite, which is in-house. Just some pictures to go along with it. Again, each center that WelbeHealth opens is built specifically for what we do. So this center was opened January 2024. So it was literally built in 2023. So when you come in, it's this beautiful new facility that really has a lot of thought and care for how the building is organized. Here's some about cost. I mean, really, they could have just put a big $0 here. Realistically, the bigger part of PACE is qualifying. It's finding somebody with the right level of medical need, because a lot of times I'll get the questions like, well, this sounds great. Like, I mean, I think who doesn't hear about the program and think, well, this is I want to do this, right? And really, who it's intended for is somebody that really needs a little bit more help medically. So this is somebody that they're maybe even to the point where they're considering, gosh, do I need to look at a nursing home? Is a skilled nursing facility the next thing for me? I really need a lot of help, or just really just not necessarily to do it all themselves. And there's a whole different levels. This is the most qualitative part of it. But once we're able to show that the person is eligible, and for that medical need, the financial side is actually pretty straightforward. If you have Medi-Cal, or you have Medi-Cal and Medicare, there's no cost for anything that you do. And that's the doctor visit, dental visit, prescription drugs, monthly premiums, health education, and vaccinations, and really anything we recommend. If we recommend you to have a a cane or walking mechanism or a wheelchair, that's included in the program. When you're recommended to have bars for the shower at home, that's covered in the program. So if we're recommending it, we think it's necessary for your health and well-being. That's something that's covered and no out-of-pocket cost to you. And Skip, if you have a question about the finances, this is maybe a good time to do it. We'll talk a little bit more about it later, but if you have the question, I'm happy to talk about it.
Well, first of all, how does this fit in with Medicare and paying? For instance, like the Part D for the prescription drugs and their programs?
That's a good question. So you're not required to have Part D in order for it to, you just need A and B. And so there are folks that choose not to continue to pay for Part D. There are some times when people choose to continue to keep it with some of the rules around if you don't carry it, then you add it later, and penalties. There's sometimes people do continue to carry that, but it's not a requirement. You don't need Part D in order for this to be covered and for prescriptions to all be covered. Another question I get sometimes about the prescription coverage is this isn't something where there's not tiers to our drug coverage. So really what they're looking for is what's going to do the best job for you. And sometimes that's the name brand and sometimes it's the generic, but really they're not as concerned with that as what's doing the best job for you. But there's no limitations or tiers or anything like that.
And also, how are you getting paid?
So we are paid on a capitated basis by Medi-Cal or by Medi-Cal and Medicare. So when somebody enrolls into the program, we submit our care assessment into both parties, or just to Medi-Cal if that's the case. And there's a risk adjusted score that goes along with it. And that risk adjusted score each 6 months or each year, that as health changes, we resubmit that to the state. And so what's interesting about PACE, and why I think as a model, I think this is going to continue to grow, is that even though there's all these benefits, and even though you hear everything's covered, and you think, well, how can this be? It sounds too good to be true. But the studies that are going on, because this is in about 33 states, and there's a lot of energy going into it because there's more and more that have need for it every day. I think the number used to be 10,000 a day. I think it's higher than that. But the reason why it makes sense is that the average PACE participant is actually a lower cost by about $10,000 per year versus the non-PACE participant when they go across those risk models. And the reason for it is because there's so much emphasis on preventative medicine. And I think that that's pretty well established, right? That preventive medicine on the whole is largely less expensive than than lack of preventative medicine. And so when you have the person that's being seen weekly or maybe even more than once a week by all of these specialists, they're able to really get in on the front end when there's changes in health versus when you kind of when you don't have that regular doctor visit, or maybe you don't know who to go to, or maybe just life is busy and you haven't seen the doctor. The problem tends to compound and get worse. When there's an event, then it is no longer a small problem, it's a big problem, and it involves, an ambulance and a hospital stay and a surgery and a skilled nursing facility, and just the amount of cost even from one of those things that escalated that didn't need to, I think really is what sways in that direction. I hope
So
that answers your question.
just to be clear, there's no out-of-pocket cost to your clients.
Correct?
It's being covered by Medicare, Medi-Cal.
Exactly
So
right.
if you have a long-term care insurance policy or a health savings account or any of those, there's no interaction with them.
You wouldn't need to. Yeah, yeah, you wouldn't need to. And so really, I mean, I guess I would say it's not categorically that the people that are part of it don't have that, but I would say the average person that is joining, I don't see a lot of HSAs. I don't see a lot of people coming in with the the long-term care plan that they've come into it. This is really more somebody that they're qualifying for Medi-Cal on an income-based uh, grounds, and there's really they don't have a lot of those resources. But let's say somebody did, they had a long-term care plan, they did a good job planning, they have the HSA, they would not need to fund anything out of the HSA. They would not need to use that long-term care plan. Now, at some point, when let's say they advanced past the point, because then again, this is going to be somebody living at home and having all these services here in the center. This is almost like skilled nursing facility while you're living at home, and we bring you to the center to do it. Now, at some point, if you need 24-hour per day institutional care, that may be where somebody then would deploy something like a long-term care plan, or something like you start using HSA dollars towards another more comprehensive solution. But even when that happens, uh, WelbeHealth is going to help with that process, right? So we're going to help transition that person to the 24-hour care. And so even that person that ends up needing a higher level of care later, we're helping with that transition and placement into those long-term care facilities, or even if it's something like hospice, and we coordinate with that as well.
What's
Okay.
the economic demographic of your business model here? Who's your person?
Economic demographic is going to be people that are eligible for Medi-Cal. I would say that probably does the best job to summarize it. So really, 3 years ago, that was a whole different picture, right? And I think where I was thinking a lot this morning about kind of what would be, because I know you guys interact with a lot of seniors, and I was thinking what would be the place that this would really be a good value add. And so for me, I did insurance for 15 years prior to this. I worked for Allstate. And so there were a lot of people, as I did financial planning and I did retirement planning, that their home really was their retirement plan. I don't, what percentage of people, I'm not sure, but a lot of people that I worked with, they had bought the home 30 years ago. They lived the American dream. They bought the home, and that home around in this area 30 years ago, they bought it at one price. Now it's worth 15 times that. And so that person has this home, and they may not have a lot of income that's coming in with that, right? So they may still be eligible for Medi-Cal. And what changed in 2024 is that home no longer disqualified them from being eligible for Medi-Cal. So for you guys, like I thought that was an interesting thing where as a value add, as you guys are positioning yourself as, uh, experts for them, and giving them options for what they can do with their home, I think that also saying, well, gosh, you may be eligible for Medi-Cal and these PACE benefits. I have a great person, that's kind of adding value for the client. So I don't know if that's appropriate, or if that fits for what you guys are looking at, but that was when I was thinking of what's in it for you guys, how could you deploy this versus just it being a great resource and knowing about it. That was kind of where my mind wandered, but I'm curious to hear what you think as well.
Well, and WelbeHealth. So your offering here is comprehensive and specific. So in the what other health agencies would somebody be able to find something like this you know, elsewhere from somebody else. Okay, so like my Kaiser is not, I have Kaiser
Hmm.
and, you know, yeah, they got stuff, but it's not the same. You see what I'm saying?
Yeah, absolutely. So when somebody has Medi-Cal, they have some choices for what they can do. There are Kaiser plans, there are Anthem plans. There's, I mean, there's a whole number of plans you can do when you have Medi-Cal. And so really, I think what the anybody that is a PACE provider. So in our area, there's in Santa Clara County, there's two. There's WelbeHealth and there's OnLock. Those are the two PACE providers here.
Okay,
Down
yeah,
down
okay.
south, there's some more. There's some more companies. I think it kind of started earlier, especially in San Diego and Los Angeles. I think there's some more PACE options. But really, anybody that's a PACE option goes on these really strict guidelines for what PACE means. You can't just be a PACE provider. You have to do all these things. You can't just put on the PACE. Okay, you gotta walk the pace and talk the pace and all that other. So um, anybody that's a pace provider is going to be similar to this. Now, that's from a regulation. I think where Wellbe really excels is that they deliver pace, but also with that mission in mind of being excellent at doing it, keeping our heart and soul, like really being compassionate with the program. So you have that confluence of pace being great, but also Wellbe Health as a provider doing a good job of keeping an eye on the things that matter.
Kind of like whole life, which is, yeah.
Well, so
You're,
yeah,
you're
Go
only in
ahead.
California, right?
we're only in California right now, so our 11 locations are in California. We have our first center opening in New York. So we're opening in Brooklyn, 2025 in January, which is exciting. And then we got a contract also in Oregon that'll be in 2025. And so we are starting to go to some other states. But truthfully, there's so much need just in California that I think their primary thing is to expand in California, but really they just want to help as many, as many seniors as they can. And again, each one of these centers, it's 700 or 800 people a clip, right? So it's a slow process, but Pace is definitely gaining steam. But WellBe Health is the fastest growing Pace provider in the country, which is kind of fun.
So the
All right.
pay system is from uh Medicare, Medi-Cal. It is governmental in nature
Yep.
then.
Medi-Cal. Yeah, so and so really
Medi-Cal.
the reason I go Medi-Cal first is that if you have Medi-Cal and not Medicare, you can still do it. It's 100% covered, no cost. If you have Medi-Cal and Medicare, same thing. It's covered. We're funded differently when it's that way, but for the participant, there's no difference. If you just have Medicare, a lot of times what I'm going to do is my first step is I'm going to have you meet with the Medi-Cal specialist to see if you can qualify, because really not by the time you'd pay all of the cost for the PACE program that's supplemental to what Medicare covers, you'd probably be looking at another option anyway, to be honest with you. It'd be cost prohibitive, $6,000-7,000 a month to do it with, it wouldn't make sense.
What are the other options? I mean, like, how do you position yourself in your service?
Well, so let's say money wasn't an issue, right?
Right.
And I'm looking at it, and I just want to choose what my favorite is, right? So a lot of times, people with the same objective, which is living. I mean, who doesn't want to live at home as long as possible? So I think a lot of times people are looking at home health, home care. They're supplementing with hours for a private home care company. They're having a caregiver that's coming in a certain number of hours per week, all the way through something like concierge medicine. So sometimes I'll relate this. I think this is kind of like concierge medicine for somebody that's a Medi-Cal recipient. It's a that's kind of the hole that it fits in.
No, I like that. Exactly.
So who is eligible? So you have to be 55 or older. And I would say a majority are that's kind of that's where the Medi-Cal cutoff is, 55 for our program. I would say a majority of people that are in it are 65 and older, but there are folks that are between 55 and 65. That's the cutoff at 55 there. You have to live in the service area. So any of those centers that are showed up behind me here on the map, you have to live within a 45-minute drive of that center. And that's really just because you're driving on a van to and from. They don't want, even if you wanted to commute 2 hours to one, it wouldn't really do a great job for you because you'd be sitting in a van for too long. So 45 minutes from an office. The federal guideline is an hour, especially in this area. We do 45 minutes just because of traffic. We want to make sure we stay in compliance there. You have to be eligible for a nursing facility level of care. So I would say I mentioned earlier, this is kind of the trickiest part of it, right? Because it's qualitative to some degree. who's eligible for a skilled nursing facility. And so we end up going through, when somebody's interested in the program, what we have them do is on my outreach team, this is a little bit different, but a part of my outreach sales team is a ERN. And so what she does is she helps write that level of care assessment for the individual. So she's going to go through the health history and medications, and she's going to talk about activities of daily living and talk about who's there to help and what the support system is like. And at the end of it, she writes this assessment after about an hour meeting. And that care assessment, called an LOC, or level of care assessment, goes to the state. And that's how we're helping people to become eligible for PACE. I think without the help of that enrollment nurse, it would be really difficult to write your own. Yeah, I think most PACE facilities are helping you with that, because you can check a box that say you want to do PACE, but you still have to prove eligibility for the program. So that's the third one. The fourth one is you have to be able to live safely in the community with our support at time of enrollment. So basically what that means is that we're unable, if you live in a really unsafe environment, or even, let's say, if you don't have a primary place you live, right, you're unhoused, this isn't going to be a program we're able to do, because we have to be able to pick up and drop you off places. We have to be able to deliver medications. We have to be able to send out home care and home health and have them be safe. So the fourth one is that safety, living safely in the community. Okay. So here's some things on the list. This is certainly not an all-inclusive list, but these are folks that we see with a higher frequency. So somebody that does have some compromised activities of daily living and IADLs, a lot of times cognitive impairment or behavioral health concerns. If you have trouble with medications and being compliant and things like that, that helps. I mean, that's something that adds to being accepted. Somebody that's having risk with falls and mobility issues. Poorly controlled diabetes is on the list here. And on this, poorly controlled, we're talking about somebody that's having trouble keeping it under like an A1C of 10. They're really just, it's out of control. They don't really know how to help it. They're maybe not adhering to medications as well. You know, that's when I see that one be more. Somebody that's on dialysis will qualify. And a lot of times, just if you're 80 years or older, there's enough there that we're able to find and make a case for you. Some other things, if somebody like Alzheimer's, Parkinson's, things like that, we do see. And really, there's so much variance, it's impossible to make a list of here's everything that qualifies and here's everything that doesn't, because you know, it's really each person is an individual, and we really see that with these assessments. Here's kind of a list that sometimes as we're out in the field, we'll talk about. So here's some more conditions, things that people might need help with. Here's those 4 requirements again. And again, some people that may not qualify. So again, if you don't have stable housing, you don't live in the service area, you need too much care, right? You need 24-hour care, and that's more appropriate. And if you're still working, even if it's part-time, then you're too independent for the program. All right. If somebody's looking to enroll, so a lot of times we start with the question, and from 1 to 4 here, we start with the question of, you know, do you have Medi-Cal? Do you have Medicare? We try to understand where you're at from an insurance perspective. And if you have Medi-Cal, then we move to the next step. If you don't have Medi-Cal, then we connect you with the Medi-Cal specialist to see if it's something you can qualify for. And again, that's something that, you know, you guys can all, at the end of this, take down my information. If you need a resource on that for somebody, even if it's just questions about Medi-Cal, we have a really great, really friendly, really approachable Medi-Cal specialist. She used to work actually for the state, and so she really knows it from the back end forward, which is nice. But yeah, feel free to reach out to me if that can be a resource. Once somebody does qualify from an insurance perspective, then that's when we do that level of care assessment I was talking about with the nurse. Sometimes they'll ask for additional information where they want a little bit more from a primary care physician or a social worker. That's if, again, if they have some follow-up questions, if the state comes back to us. Once the state has accepted, then that's when we'll meet with our enrollment specialist. We enroll on the 1st of the month every month. So right now we're taking enrollments for January 1st, but that'll go all the way through the year. So we don't have an open enrollment period here. And then once somebody has enrolled, then we deliver them their welcome kit, and that's when they start reaching out from our participant navigator. So for your first 90 days of the program, you actually have a one-on-one contact with our participant navigator that's going to schedule those 8 assessments, right? So when you start the program to make that care plan, you're going to meet with your doctor, you're going to meet with the physical therapist, with the occupational therapist, the dietitian, the social worker, the day center. and then you're going to meet with home health, and then just the center manager. And those 8 people get together and they make you this really individualized care plan, which I think is, again, this beautiful thing. But it does take, for the person that, let's say, doesn't want to do 8 health assessments, sometimes that's too much for them, right? Because this is pretty high touch. It's a high touch program. Then that navigator will help them every step of the way. They'll help them schedule their appointments. They're there as a one-on-one resource for questions that they have. And really, because those caseload is 100 to 120 participants, the amount that your care team, not just your primary care physician, but your whole care team knows you. I mean, you really are on a first name basis with your team, and the amount that they know you and can care for you and recommend for you is pretty special. So that's what it says. Your WellBe team will call you to get to know you better, and that's certainly true. It's a voluntary program. Enrollment process, it says here it can take 15 to 45 days. It kind of depends when you start the enrollment process. So I mentioned we're enrolling for January 1st right now. So our last date to enroll somebody is tomorrow, so Wednesday the 18th. And so let's say if you do your LOC tomorrow, it's not time for our nurse to do the write-up and for the state to approve it, which takes about 5 business days. And so for that person that's interested today, they're probably looking at a February 1st start date. So that's the timeline, 15 to 45 days. They can, of course, disenroll at any time, and that's the first of the month every month. If they choose to go back to what they had, or they're moving out of the service area, or moving out of country, whatever it is, right? You can disenroll anytime. There's nothing binding to any of this, right? It's a month-to-month program. Once enrolled, all healthcare services in non-emergency situations will be provided through WelbeHealth. So we have Sutter, Palo Alto Medical, and Stanford is our network. It's a really strong network. There's over 3,000 individual providers in the area. If you have an emergency, you can go to anyone. It doesn't have to be a contracted office, but kind of like Julie mentioned having Kaiser. It's kind of like Kaiser, right? If you're near a Kaiser, they'd like you to go to Kaiser, but you can go to any emergency room if you need to. All right. This talks a little bit about the pandemic, which I think we touched on earlier. This is a video that shows the GrandPad, but you can see the icons here and kind of the size of them. Getting an email or playing games or asking for help. Again, just a nice tool to have. Also, the data plan is included. So let's say we do have some folks that maybe don't even have a cell phone, right? And they're not really interested in paying for a data plan. If you have a GrandPad, the data plan is included, and so it really helps your accessibility. Follow summary page, and then I'll take questions here. So again, it's 55 or older, live in our service area, eligible for a nursing facility level of care. What's covered? Full service senior health care covered by Medicare and Medi-Cal, or just Medi-Cal at no cost for those who qualify. And then I'll leave this up. This has my direct phone number here and my email. And yeah, it really, honestly, if you guys have questions about it, if you have somebody you think would be a good candidate, whatever it is, feel free to reach out to me. And yeah, at this time, I'll take any other questions that you guys have for me.
There's some in the chat, by the way.
Oh, let's see. Where do I get to the chat here?
So, one of the things is, your contact information, which you just did put up, and it's on the front of the bulletin as well. So all your contact information. And I think, Angel, did you have a question?
No, I didn't.
I actually do. So my friend, her mom, was in her house, and then her husband died, and then it went into a trust, and the trustees put her in a home, but the daughter is the executor, so she's trying to get her out back
Okay.
into her home.
Okay.
So, can you help with something like this?
Yeah, I mean, honestly, that's a great candidate, right? It's somebody that's eligible for a skilled nursing facility, but they would rather be home and independent. And again, I always say that afterwards, who wouldn't? This might be the perfect candidate, right? Because again, they're eligible, they're looking for resources to be at home. The family, without a program like this, would take on all of that care coordination themselves, right? They would do all the scheduling and the transportation to appointments. I mean, typically, the average person has in the program 4 to 6 chronic conditions, so they're seeing a lot of specialists, and I think that, yeah, I'd love to hear more about it. But my initial knee-jerk reaction is definitely this could be something to look into further. Where are they located out of?
She's in Menlo Park. So what's your name? I'm sorry, I got in late.
Oh, that's okay. My name is Luke Priebe, and so I'm the Director of Marketing Outreach and Enrollment here in San Jose. Now, Menlo
Okay.
Park is just on the outside of our service area. It stops right
All
at
right.
the end of Santa Clara County. And actually, so I live in Redwood City and I commute over here. And so I'm really hoping we get into San Mateo County. We're not in San Mateo. Is the home in Menlo Park as well? The-
I think she's in a facility. I don't know where it is.
Well,
But
feel
where
free
do
to
they
reach out to
live?
me.
Where does she live? Where's the house?
The house is in Menlo Park.
Okay.
Oh, yeah.
Yeah, so probably, and unfortunately, San Mateo County is one county in California that doesn't have any PACE at all. They have not approved it yet in San Mateo County, and so we're hoping to be in there sometime soon. But so right now there's actually not a great PACE option. But I may have other resources for you if you want to reach out to me after.
You said you were going to share the information on your Medi-Cal person?
Yeah, yeah. In fact, what I
So
can
Luke, what
do.
is your, I give, can I
What was
give
that?
them your number? What's your number?
Yeah, my number is
Katie, it's
408.
Katie, I sent
slide.
you his number.
Okay, sorry.
You got it.
Okay, thank you.
What I
Go
can do
ahead,
too.
Mickelin.
Oh yeah, Mikkel,
Are
go
you
ahead.
sure? I wanted to give a scenario until you said that you're only Santa Clara County. I have a good friend and client now. She wants to sell in Santa Clara County and move to Hollister.
Okay.
So she has, I think she would qualify for all these, especially if you don't have, the income is not a requirement.
Yeah, I mean income. So the only place that income is a requirement is just to get Medi-Cal. Like PACE doesn't have any requirement for it. WelbeHealth doesn't have any requirement. But in order to get Medi-Cal, I think they will look at income as a qualification for getting Medi-Cal. But if your friend, if they're like, I have Medi-Cal, then at that point we don't even ask any follow-up questions about income because that's all that needs to qualify is
Yeah, she
Medi-Cal.
gets Medi-Cal. She does
So
get
then yeah.
Medi-Cal.
So
And
she'd be good to go. Yeah.
she would be, well, her physical therapy had to stop because she used up her 60 or 30 days, whatever it
Right.
was. And now
Mhm.
she has to pay for it. But what she wants to do, and I've been through so many of these retirement places for her and with her kids to find the right place. But she's been to about 5 places in 6 or 7 months. And I think she's fed up. We're all fed up with it at this point.
Yeah.
But if she could, what ideally, she doesn't want to pay the cost of these retirement homes, even though she gets all
Mhm.
these services. She
Right.
wants to sell her house and move to someplace cheaper, San Benito County, Hollister.
Mhm, mhm.
And I looked at gated homes and stuff. She doesn't care about that. But she does need these services, and she's going to away from her family, which is right here in
Mhm.
Santa Clara County. So
Mhm.
I don't know if this, it sounds great until you said the limitations as far as location.
I'd
What's
Well,
use,
so
considered?
there's
I'd
10
use
locations.
WelbeHealth as a reason for her to stay here.
But her house is not that accommodating. The place
Well,
where
we can fix that up. Go ahead, Luke.
Well, I was gonna say there's also other locations. So there's one in Fresno, Modesto, Stockton, and then there's 6 in Southern California. But even if it's not WellBe Health, I think maybe as you're choosing which location to move to, maybe seeing if there's some kind of a resource like a good PACE program in where she's looking to move could be something that's, helps you choose between one area and another. But I do know that the most well-developed WellBe Health, like the one that I mean really has the highest rating of them all is in Fresno, and there's a really great community there. I don't know how far she's looking to move, but the other
since
option
Fresno
is
to Hollister,
Luke,
that's a distance.
yeah, I don't think it's I don't
yeah,
think it's in
Luke,
the
there's
Fresno
no
area.
PACE program in San Benito.
Oh, okay.
There's no PACE program in San Benito County. Yep.
I believe it was
So
it's
not
not
even
everywhere yet.
WellBe or anybody else, no program in San Benito right now.
Okay.
Wow. And that assessment that you talk about, is that like the 602 you have to do when you go into a facility where they do the assessment in terms of your medication, your mobility, how much services that you need? So is that you're doing the same type of thing, right?
It is, right? Because they're determining a similar thing. So they're both determining your eligibility for skilled nursing level of care. Both, so basically once you have been determined eligible, you could go into the skilled nursing facility, or you could do a program like PACE where you don't go into the skilled nursing facility, but you're honestly receiving all those benefits from a nursing facility, but living at home. That's the model. And I wanted to introduce Joe's actually on the call here, he's our regional director here for all the broker market. And so I wanted to introduce him to everybody here.
Hey, guys.
He's actually from
Hi,
Fresno. So if you had any
Joe.
Fresno specific questions, he's your guy.
Yeah. Hey, I also wanted to let you guys know too that if this is something that you would like to offer for your clients, you can actually sell this program. You don't need to be Medicare licensed. You can actually just go through my program, get certified, and actually get paid. If it's then just let me know. We can actually get you certified to sell WellBe as an option for your clients.
I love that idea.
Mm-hmm.
Wow, that's amazing.
Hey, folks, Luke, this is Angel. I do have a question.
Yes, sir.
You know, it looks like Medi-Cal would pick up the bulk of this cost, but only if and when these people are found to be eligible. And a lot of folks it's not such an easy thing to become eligible for Medi-Cal sometimes because of whatever income or asset tests that they may have.
Sure.
So in your experience, do you find folks that are just on Medicare, but it's going to be a combination of Medicare and out-of-pocket expenses paying for these services?
So at least with WelbeHealth, there are some PACE providers that they're kind of looking at they're kind of in that concierge medicine space. They're delivering a PACE model and it's their people are paying for it. I would say more commonly with WelbeHealth, it's less than 1% that just has Medicare and not Medi-Cal. And so really what we're looking at first and foremost is might you be eligible? Now, one thing that I'll mention, which I hadn't mentioned earlier, is that sometimes you can be eligible for Medi-Cal, but they can assign you what's called a share of cost. And so these days, as they've opened up the eligibility, they've also opened up this determinant, which is share of cost, which means that when you use your Medi-Cal benefit, you have to fund the first however many dollars of it yourself, and then past that, Medi-Cal will pick it up. WelbeHealth still has a program, and in fact, since I've been here, they've had it where if you have a share of cost, we fill out a questionnaire with you and essentially look at your expenses versus your income. And a lot of times we can waive a large majority of that share cost. And in a lot of cases, they waive the entire share of cost because again, the core mission of the company is to help as many people as possible. And I don't know if it's something they'll do forever as we grow, right? But right now there's a lot of folks that they are choosing not to. Basically, it's they don't waive it on the Medi-Cal end. They're just choosing not to have the person pay that share of cost to us.
Okay.
And your
And don't
contact
forget, if you're
info-
65 and over, there's no asset test anymore. So it's basically based off of income at that point. So as long as you're 65 and over, there's no asset test anymore as of the first of the year.
Yeah.
Yeah, very good.
And your contact info for the Medicare person?
Yeah, you know what I'll do, Skip, is that what I can, I have the email that Julie sent me that has everybody. I can reply to that and I can put just a couple resources we talked about. I can put a one pager on PACE. I can put in the contact information for me, and the kind of the information for our Medi-Cal specialist. And again, for the most part, you're going to schedule that. Really, you schedule it for me or through the center because there's different Medi-Cal specialists in the different areas. So you'd probably go through me to schedule it anyway. But
Well,
then also.
I'm thinking of getting him for the Tuesday talks here.
Oh, okay. Okay.
See-
Yeah.
Well, I'll talk to you offline. I want to talk to you about getting information that I can insert in the SRES course too.
Sure.
Oh, yeah.
Absolutely.
That's a great idea.
That's why I brought it up.
Plus,
I like
those
it.
of us for our CSA stuff as well. You mentioned that you were having an event this week at your location.
Yes, thank you for reminding me about that. So this Thursday we're having our open house in San Jose, which is on Hamilton Street, on 1799
Avenue.
Hamilton. It's from 10 to
Hamilton, yeah. Oh, go
10 to
ahead.
2 on Thursday.
Mhm.
And basically we're going to go through just tour the facility. Anybody that will have some lunch out there and everything, but mostly just for people to see it, put a face to the name, and see that it's a real place. And I think what you get when you come here is you see all of the when I talked about the culture and the smiling faces and the people that are delivering the care, you really feel that when you come into the center. So it's a neat place. I encourage you guys to come, and honestly, if you do want to come, shoot me an email. I can put you on the list there. Even if you don't put your name on the list, you're welcome to come by. There's also ones for folks that are in other locations. Fresno has an open house once a month. The 6 Southern California locations do as well. So it's really approachable. Again, I think PACE is one of those well-kept secrets that there's so many benefits. When you hear about it, you think this is great, but I'd say maybe 10 or 20% of people know about it because it's pretty well-kept secret. So
Do you work with area geriatric care managers?
some, yeah. So we do. So sometimes a lot of times they'll come in. Most often they'll come in because they have somebody that they're working with that's considering WelbeHealth, and they just want to see the facility and make sure that everything's up to snuff. But yeah, we do. We're always offering to do education, other places, or host events or resource tables. We might even have a resource fair here someday, and if we do, I'll reach out to you, Julie, and you can be a part of
Yeah,
that.
that's a great idea. Let's do it.
Yeah, so and I think Micklin, did you have another question there?
Yeah, Micklin, go ahead.
Yeah, I did too. As far as my client staying here, there's a reason why she doesn't have to move, but the house is not, it would have to be revamped for her to stay there because of her physical limitations. But the other thing I wanted to ask, do you do the same kind of talk to churches? The reason I'm asking, we're developing something at our church for seniors. Our church is an aging church. So we're talking about Medicare, Medi-Cal, all these different things that seniors need. How are they planning for the rest of their lives? And many times we find they are not. So are you open to that?
Absolutely. Yeah. And
Okay, cool.
and there's kind of two different things that we can do. So, and I would say, even though we've been to a lot of churches in the area, have we even come close to getting to even a quarter of them? No, because there's so many. So absolutely, we'd love to. We can do a what is PACE, what is WelbeHealth, kind of like this presentation here. We can
Yes.
also do a what is Medi-Cal? Might I qualify for Medi-Cal? We can do a more Medi-Cal specific or changes in Medi-Cal in 2024. And what's nice about that is you can even do a two-part thing, like what is Medi-Cal and what is PACE, and we can kind of bundle the two of those together as well. Sometimes people will just have us come out and do a table at food distributions or even just after church or resource fairs. And so the answer is I'm open to any of it. We just want to get in front of as many people as we can and help as many people as we can. And so I'm definitely open to it if you want to
Okay.
let me know.
I'll be in touch because there's a lot of confusion behind Medicare, Medi-Cal, which is which, and how to qualify. And we're trying to get even some of the they may not be 65 yet, but certainly 55, and how they should be planning now in their 50s, 55, and so forth. And what's
Absolutely.
your open house address again?
It's 1799, so 1799 Hamilton.
Is that in Campbell?
Yeah, it's right next to Campbell. It's not. It's as you go out of Campbell into San Jose, we're just down a little bit further. So as you pass eBay, but right before Meridian.
Close to
Oh, okay.
Meridian, yeah.
Okay,
Hamilton
thank
and
you.
Meridian.
Thank you.
Hey, folks.
Yeah,
Just
that's
down the
amazing.
street from my office.
Yeah. Yeah,
I just
Lynn,
wondered-
right down the street.
Yeah.
Angel, you had a question. Go ahead.
Yeah, and I apologize. I'm dealing with a little bit of a cold here. Some of these issues regarding Medi-Cal and seniors, it's fascinating. And I think I may circle back to Luke or Joseph because I've actually got somebody in the Fresno area that I'm thinking of. But there's other tools out there. There's what I come across. So we offer a MetLife tax deferred annuity for the sale of property, including a primary residence that can help some of these folks. But I'm also dealing with special needs trusts where those assets go in there to protect Medi-Cal eligibility.
Mm-hmm.
And that could be important for some of these older folks, especially that don't know that's another option and have Medi-Cal pay for the services of, Luke's company, things of that nature. There's also Medi-Cal or Medicaid compliant annuities that allows folks to put assets into this annuity, spread the payments out over time, and still remain eligible for Medi-Cal. Again, these are things that can indirectly or directly help folks apply and get into Luke and Joseph's services. I mean, the services you guys provide are exceptional. I mean, like you said, Luke, earlier, it's like it's like this hidden thing that's out there. Once you hear about it, you're like, what? This actually exists? Now I'm thinking of all my clients that I can actually help. And doing some of the research, I think initially on my end, asking these folks, hey, what are you eligible for? What kind of assets do you have? So when I reach out to Luke or Joseph, I've got a somewhat of a better plan in front of me, so we can have that discussion, and then find out, okay, what do we need to do now, and at what point do I introduce my clients to you folks directly?
I think those are some great points. I hadn't heard about annuities like that, but it makes so much sense, especially before the asset limit, right? If when you can only have a certain amount of assets, having it an asset that then paid at an income that was below the threshold is pretty genius. So I didn't even know about something like that. So yeah, we should definitely talk more. It's
Because
interesting.
even the one I have, I mean, they've got this individual has rental property. So if I remember correctly,
Yep.
Medi-Cal says, well, you can have your primary residence, but you can't have more than that. So then it may become an issue of, well, let's put all these properties into a special needs trust, make you qualified for Medi-Cal, have Medi-Cal pay for Luke's services in the meantime, and then you retain these assets on this back end. So there's stuff out there. So this is all very, very interesting.
That's really smart. That's really smart because you're right. They do. I think it's with the houses, when you're getting the income from the rental. So I think if you have the house but you don't rent it out, that's one thing. If you have the house and you rent it out and you're receiving income, then it's different rules. But you're right. It's putting it into some kind of a trust is really a smart way to look at it. But yeah, love to talk with you more about it.
Yeah, appreciate it. Thank you, folks.
So sorry, Luke, this is Lynn. Thank you for your presentation.
You're
So,
most welcome.
yeah, I'm thinking actually about my parents and if they qualify. And from the last speaker, it sounds like, so my parents, they do have, rental properties besides their primary residence, but my mom has dementia and they do have Medicare, and they have, I think it's called alignment, where she has like a nurse coming maybe once or twice a week to take her vitals and to bring, supplies like diapers and stuff. So would this be somebody that you guys would not serve because they have the rental properties, or how does that work?
So it would all come down to do they have Medi-Cal or don't they? And so this is something like what Angel was talking about. That would be something that maybe they would be good candidates to look into, something like that. It would really come down to if they have Medi-Cal or if they don't have Medi-Cal. Sounds like if they just have Medicare right now, they'd want to look into that. I'm familiar with alignment, and they do some interesting things like that, like you're talking about with the home health. But that would be the qualifier, really, even over the health. Sounds like from a health perspective, certainly, it would really look at the Medi-Cal and whether or not they're on that. And again, if you want to chat about it offline, I'm happy to go into details on it too.
There are
Sure.
attorneys that help with this too.
Yeah,
What'd you say?
absolutely. I mean, I think at the end of the day, like with myself and annuities and things like that, I can offer services and products, but at the end of the day, you're going to want an expert in that field to kind of bless whatever you're trying to do. But I think based on the previous question, what we try to do is, before, with anything else, before you pull the trigger, ask all the questions, make an informed decision. You don't want to jump ahead too far and then find out, geez, I made a mistake. I shouldn't have done this. I should have talked to somebody else. And what we try to do is, gather as much information as we can to make an informed decision, then turn them over to the experts, be it a tax attorney, a CPA or financial planner, or somebody else that can come in and say, yeah, that looks like a decent plan. Or you guys should tweak this here to make sure this conforms to whatever we're trying to do.
Absolutely, and just being on the front end of anything, I think is helpful, right? Get all the information up front, then make the decision that works best for you. Absolutely.
Definitely. Does anybody else have any more questions? Questions, comments?
I have a quick one. That WellBe, what do you call it? A WellBe tablet? Do
The
you
gram pad?
include that? Yeah, you include that with your services? That's neat.
Yeah, and so really what they're looking at is because there are some people that aren't interested in having one, it's I would say not everybody has one, but yeah, it's something that's included. If you think about it, it's just such a nice way to be able to, because again, we're on the clock all day. We want somebody to call us first when they're not feeling well. If they're curious, gosh, should I call an ambulance or should I, we have somebody call us. Well, we can give you advice. Are you feeling faint because you forgot to take your medication? Do you need to drink some water? Or is this we do need to call that ambulance, right? We want to be
Hmm.
in touch, and I think just a grandpad really allows that open contact, the video chat, and just the ability to connect with somebody. Um, so it is something that they deploy a lot, and it works really well, especially in 2020. You can imagine how how critical that was.
I saw the one years ago, wasn't that long ago. The granny pad. They had it at one of these stores. And it was already connected to your children or whoever. You just hit a button. So it made it very simple for a senior.
I know some people that could benefit from using the grandpad. Is that what you're calling it?
Mm-hmm. Yeah, grandpad.
Grand. And I saw that those when you had the slide up for that and the buttons. I'm like, oh, I like that because they're big buttons and it's so simple.
And just a reminder that Wesley Chang, who's been on here before, has a company called Televisit, which is basically the same thing. They have the pads, and they have a whole schedule of events for the whole day.
Hmm.
That's cool.
Oh yeah, definitely. It is like that. Anybody, any more questions? I'm looking forward to, I'm gonna come by over there on, you said Thursday, right?
Yep, Thursday from 10 to 2. Please do.
That would be fun. And
Luke, if I connected you with my dad, because I would might like my dad just to bring my mom just to see. We're not going to be available, but can I connect him with you and can you just give him the address and all that good stuff, like a flyer?
Definitely. And so what I'll
Okay.
do is in this email that kind of had the flyer here, I'll put the flyer for WelbeHealth. I'll put some contact information, like I was mentioning. I'll put Joe's contact information for anybody that even would want to become, I don't know what the program is called, the ambassador program, where if you're not a health insurance agent, you can still refer people directly. I'll just put a bunch of info like that, but in there will be my contact. And yeah, I'd be happy to talk with your dad directly. Yep.
Okay, wonderful. Yeah, I'll send my sister who's kind of helping with the mom situation too.
Okay. Sounds good.
amazing. And I love that ambassador program. That is such a great idea. As for us as senior real estate specialists, um, this is one, and this is such a good learning opportunity for us to know because we take care of our senior homeowners and families of senior homeowners, and all of this is part of that. This is our industry is morphing into more of this kind of caregiving and opportunity and working together with colleagues and collaborating.
I love it. This is a great group you guys have. So thank you guys so much for having me. And I'm happy I ran into you at the Silicon Valley roundtable, and I'm
Well,
sure
and
we'll
that too, and plus Skip, so they were at the AO50 community event at the Campbell Community Center in August, I think it was.
Yeah.
Yeah. Yeah, and had a big table there. And so I saw them there initially as well. And so, and we had a really good turnout at that event too. So
Well, and any I guess one step further, if you guys have any other places you think it would be good for us to join you at or be a part of or table at, somebody mentioned, that the church, we're
yeah.
open. And the big thing is nobody, I mean, I won't say nobody, but a lot of people, when we were at that Active Over 50, this is a forum for people 50 and older, or 50, whatever the exact age was. Still 90% of people hadn't heard of PACE, right? And so it's not well known. I really
Mhm.
think there's a lot of merit to it. And anytime you guys have forums that we can do that, we're open to get out there. So let me know.
Yes, we're business planning for 2025. You're gonna be a fixture now with SRES for
I love
sure.
it, Julie. Thank you
For
so
sure.
much.
I appreciate it. We learned a lot and it's so true. So, thank you so much for all of that information and for being there. And, we'll be looking forward to a lot more interaction over the next year. Really appreciate it.
My pleasure. Happy holidays to you all. Thanks again for having me, and have a great day.
Thank you.
everyone.
Thank you.
And don't
Thanks, Joe.
forget,
Thanks to Joe too.
don't forget, we will not be meeting for the next 2 weeks. So the
Okay.
next meeting is going to be January 7th
Yeah.
with Dignity Memorial. And I think you might have somebody there from Dignity that can talk to us. So
They went to an appointment, so we're gonna get
went
that
with the
set up.
refrigerator. Yeah.
Yeah, they went to the refrigerator.
Yeah. Well, okay, but just keep that in mind. So don't be tuning in next week and going, where is everybody?
Oh no, I'll probably be sending out something and keeping everybody posted over the holidays. And then over the holidays, if you guys think of something that you would like to learn about, discuss, share, in the coming up in the next meetings, I'm still always looking for ideas from you guys. So keep that in mind.
Luke, are you available this afternoon for a call?
Yeah, I'm available this afternoon. Let me take a
Right.
quick look. But yeah, just look at my calendar real quick. So yeah, I'm from now until about 2, and then between 2:30 and 3, 4 to 5. So anywhere in there. Give me a ring.
Okay. I'll give you a call in a little bit.
Thanks, Skip.
Real quickly, does anybody have any coming soons, any closings, any senior homeowner issues?
Well, I
Don't
just
do.
mentioned mine, so I think Luke answered my question.
Oh,
But I'll be,
Micklin,
yeah,
there's
I'm
so
gonna
much
be emailing.
opportunity with your client there because she does have these issues going on that
Yes.
you can provide services for.
Correct.
Yes,
I'll
amazing.
be in touch with Luke for sure.
Yeah, definitely.
And don't forget, my next SRES class is January 22nd and 23rd. And even if you have your SRES, you might want to take it for a refresher. As you see here, things change. So I'm incorporating those ideas in the next class. So bring your colleagues and your coworkers and sign up and take it again.
Luke, one of the things that one of our mandates, our missions as SRES is we do work with senior homeowners and the families of senior homeowners. And one of the things is that the families do want to age in place. And we help them preserve, protect, and leverage their real estate asset in order to meet the needs of whatever's going on with the family over time. And this sort of situation is just so beneficial to the families that want to age in place. Now, and this is for you to know as a service provider when you're out there talking to your families. Aging in place doesn't always mean the same place that they're in
Right.
at the time, because aging in place is fine, but the place that they're in at the time might not be appropriate. And so we are there to help them to identify their next place so that they can age in place. And this kind of system availability is super. Yeah, aging in the right place, right, Lisa? That's right.
I like that.
And yeah, Lisa's CAPS too, which is a certified aging in place specialist as well. This is what we do. I'm not sure because as realtors, and we are senior real estate specialists, our services are much more comprehensive for the care of, and it's not just seniors. I mean, it's the whole family. So because everybody's affected, right, Lisa?
Absolutely. I was just doing a podcast today and we were talking about how aging is not a 1 or 2 person process. It involves the entire family. The entire family is affected.
It takes a village.
It absolutely does.
Yeah. So, all right, everybody. Thank you so
you.
much.
Thank you. Thank you,
Happy
Luke.
holidays. Happy holidays. See
Merry
you guys next
Christmas.
year.
Merry
Thank
Christmas.
you.
Merry
Thanks
Christmas.
so much.
Bye.
Okay, I'll see you. Thank you, Joe. See you guys on the computer. Thanks, Michelle.
Bye,
Thank you.
Bye, Valab. Hi, Margarita. Thanks for being here. Have a good Christmas up there. In
Thank you so
Folsom.
much. I've been double dipping over here, so thank you.
Okay, I'll see you
Thank
guys
you so much.
on the
Bye-bye.
computer.